I actually was in the process of looking for a new dentist, and I was in need of a root canal. And one of the girls I worked with said, "Hey, I go to this dentist. Why don't you give him a try?" I did, and I've been here ever since. I've been with them, I guess, about 10 years now. I was petrified when I first came in, but, they've made me feel more than comfortable. I feel very good when I leave here.
I'm here with Sheila, and she has a sensitive tooth, so I'm going to do some tests. I'm going to tap on the tooth to see if it's sensitive, and it is. And then I'm going to go ahead and try some cold stimulus called endo ice. We're going to put a little endo ice on the tooth, and with endo ice, if it's sensitive, and it is, we're going to go ahead and start root canal. You just had root canal?
Yeah.
Wasn't too bad, was it? Did that hurt?
No, that was easier than some of the fillings I've had put in.
Super. All right, we're gonna get a quick X-ray,
Okay.
and we're gonna go from there.
All right.
She should be okay. She's gonna be sore for a couple of days. We're gonna give her some pain medication. She'll need to avoid the tooth, eat on the other side of her mouth, and she's fine.
Dr. Gordon's work on me has been spectacular. He actually did a crown. And he did it, and it was so painless. Dr. Gordon fixed my tooth, and it was literally pain-free.
Here we're going to be doing a crown preparation on a patient. This patient had root canal, and after the root canal is done and a tooth that you bite against in the back of the mouth, the tooth will need a crown. And that's what we're doing here. I'm actually preparing the tooth for a crown. Crowns are also known as caps. What we basically do when we do a crown is we trim the tooth down and make it smaller. So that's what I'm doing here.
Dr. Gordon used dental air abrasion to fix my one cavity that I've ever had, and it was absolutely painless. I didn't even know that it was over when it was done. It was terrific. It was a wonderful process, and I would recommend it to anyone.
Here we have Robin, and she has a small cavity on her lower right first molar, and it looks pretty shallow. So what we're going to do is use air abrasion, and that's a technique where we don't need to use a needle or a drill. I'm just going to use this small handpiece. It's like a little small mini sandblaster, and what it's going to do is it's going to shoot aluminum oxide powder at the area of the defect, of the decay. Here we're taking impressions for upper and lower dentures. We're trying the trays in to make sure that they fit. Then we go ahead and fill the trays up. The first part of the impression material that comes out is not properly mixed, so we let that go on the tissue underneath, and then we load the tray with the properly mixed material. We also examine the impression to make sure it's accurate enough. If it's not accurate enough, we can add to the impression and customize it. The better the impression is, the better that the dentures will fit. So it's very critical that the impression be just right. So here I'm just fine-tuning the impression to make sure that she's going to have the best possible fit of her dentures.